Dr. Haniffa, great to have you on our program, The Business Detective. You are the president of the Sri Lanka Medical Association. What is the real difference between the SLMA and the GMOA?
Thank you very much, Dinesh, for having me on. It's a pleasure being on a program titled The Detective. Has always wanted to be one, so this is my chance. Yeah, so to give you an overall view, the Sri Lanka Medical Association is the apex professional academic body which represents all grades of doctors, that is private sector, state sector, academia, junior doctors, consultants, and medical students. Whereas the GMOA is the Government Medical Officers Association, that is the membership is only, I repeat, only open to doctors working in the Ministry of Health of Sri Lanka. So they may be grade medical officers or consultants. So the prerequisite is where to be drawing your salary from the Ministry of Health to be in the Government Medical Association. For example, now I am an employee of the Ministry of Higher Education of Sri Lanka, but I cannot get membership of the Government Medical Officers Association because it's not within the Health Ministry. So their membership is purely state. So that is the biggest difference between the two organizations.
Okay. Doctor, what are some of the challenges faced by your members currently?
Yes, Dinesh. So that not only the members of the Sri Lanka Medical Association, but I think all doctors in Sri Lanka are facing huge challenges in terms of two. One is in their personal health status to be able to deliver good health to our people. So we are also subject to all the pandemics and other illnesses which are going on in the country. And at this very moment, though we are doctors, we also suffer from various illnesses and so on. So we need to be healthy to treat our patients. So for example, the acute drug crisis is a huge problem, not only threatening the medical professionals personally, but also it hinders our delivering of care. So the affordability, availability, and the accessibility to the drugs is the current major issue faced by all doctors at any grade in Sri Lanka.
Okay. Doctor, people are saying that the doctors are holding the public to ransom when it comes to getting their benefits and car permits and etc. What are your thoughts?
Yes, I would tend to agree with that, because what a trade union does is they work for their members. So when you look at it from a trade union's perspective, getting a car permit, getting your child admitted to school might be the thing to win votes within the trade union. But the problem is we are not just a trade union, we are a service-based organization, and most of our members are educated with public funds. So we have a duty to provide a service, whatever our trade union demands may or may not be. Therefore, holding patients who are sick, who are suffering, to ransom to gain your personal demands, trade union or otherwise, is medically unethical. Maybe it is trade union wise, political wise, maybe it is ethical, justified, and even I would go as to say moral, but it is medically certainly not ethical holding your patients to ransom to get your personal demands and your trade union's demands. So therefore, I have always been opposed to strikes by medical professionals. That includes, Dinesh, not only doctors, nurses, paramedics, and so on. They also should think twice about striking, holding people's health to ransom.
Doctor, you do a lot of teaching in the University of Colombo, and people like you actually mold these young doctors. What would your advice be to a young doctor?
Yes, Dinesh, that's a very good point, because I teach students right from the third year right up to the final year. So I tell them with regard to health, I often quote Max Planck to them. Max Planck used to be the boss of Albert Einstein. He says that science doesn't change because old scientists change their mind, but because the new scientists come with a new generation of thinking. So with regard to the health sector also, I tell them, listen, I am a teacher from the 18th century books who is teaching you 19th century knowledge, and I'm trying to teach you 21st century students. So we give them that overview. But Dinesh, I have to tell you, But when they go into the wards and go into the health system, that is where, if I might say, they become corrupt, because we are also a microcosm of society. So within the hospital structure, within the doctor structure, you see those values, attitudes, and so on percolating towards us also. So we might teach them, but when in practice, when they see things done, it is not done the way we like. There are often ethical issues, there are issues of professionalism. We as a university are trying to address that, but we are seriously hindered by the values and things which are prevalent in society. So we are merely a reflection of society. So am I, and so are my students. And that is going to be the future until we change the value system in this country for a better future.
Okay. Sri Lanka provides the basic free healthcare. How do we achieve universal healthcare?
That's a very good, just a minute, sir. Okay. That's a very good question, Dinesh, because universal healthcare and basic healthcare are two different things. Basic healthcare is about equality, where we become equal to people and all. But in universal healthcare, we're talking about equity. That is, for example, if you want to pick a fruit from a tree, if you are a short person, you will not be able to pick the fruit, but you're on the ground with all the rich people. So we need to support you in a particular way, maybe give you a little more support than the middle class or so on. So we are working towards a plan towards that. We have a it's called Universal Healthcare System. I think the WHO has adopted it as its policy. So we are trying to do that. If I may take a minute, Dinesh, to explain that, that is principally based on a thing called primary care, where you give basic services like you very correctly mentioned. But in Sri Lanka, the problem is our people flock to hospitals to even get basic care. So then what happens is the cost goes up and you don't give quality primary care, but you end up giving sub-quality secondary care. So that is the issues which we are faced with in converting primary care into a universal health coverage.
Okay. Medical negligence is also another big issue for the public. How does your association deal with this?
Yes. So now that is a question of professionalism and ethics. And if you see the newspapers in the past few years, pre-COVID and even during COVID, I don't want to give you examples about doctors trying to get COVID vaccines over others and so on and so forth, which are serious issues. But with the particular question to negligence, where a doctor has by omission or commission not done his duty towards his patients, that is a huge issue. But Dinesh, I must tell you, our Sri Lankan patients are still quite naive. They are not I'm not asking them to pursue that angle, but they are not pursuing it because they are in a different frame of mind. The doctor is God type of mind, so he can't do any wrong. So things are changing with the younger generation, with the youth and so on. They are beginning to ask questions, and medical negligence is going to become a big issue in years to come. It is not a major issue right now. You would have heard a few cases, but far and far in between, nothing very, very serious to affect the practice as such. But in the future, with generations becoming more accessible to data and so on, patients are going to be more empowered. They are going to demand more of their doctors, which I, of course, think is a good thing, because doctors will deliver much more care. They'll be patient oriented, and it will be a good if the sword of the Damocles hanging over you might be helpful in giving quality care.
Okay. Doctor, there are also concerns about how pharmaceutical companies are regulated and also approval for drugs, new drugs. What are your thoughts around that?
Yes, Dinesh, this is a huge issue. Even in the current context of this drug crisis shortage, this has become seriously highlighted, because there's accusations against the pharmaceutical industry that they are profiting unduly at a time like this. So to take your question in a wider perspective about the regulation of drugs and the price control and so on, we come back to our thing of affordability, accessibility and availability. So the government in our settings has to play a role. That is why even in developed countries, there are drug regulatory authorities. which check the quality and the price of the drugs. So certain drugs are subject to price control, which is against market forces. But in third world countries such as resource poor settings such as ours, we must have some degree of balance between free market and drug control prices, because we need to be equitable. Like I said, therefore, we have the National Medicines Drug Regulatory Authority, the NMRA, which comes under the Ministry of Health. It needs to, various people try to streamline it by drug regulations, by digitalizing and so on. But we need a much more transparent process and a much more quality-backed process if we are to move forward in that area.
Okay. Any thoughts about how private practice should be regulated?
Dinesh, that's a very good question, because when you take private practice, 99% of the doctors engaged in private practice are government servants. So if you take the era before 1977, you had to make a choice between either you're going to be in the government sector or you're going to be in the private sector. With the liberalization policies of the then governments, it was permitted that government medical officers are also entitled to private practice. I don't see it as an evil, because the doctor becomes available to more people at a given time. But the thing is how it is regulated. For example, you take myself, I'm a general practitioner and a family physician. So if I am to ply my trade, I have to stick to certain rules and regulation. The thing is, if you're a surgeon, you operate in a hospital and so on. So if I go to do private practice in surgery, or a surgeon comes to do private practice in general or family medicine, that is a problem. So therefore, the Sri Lanka Medical Council, which registers specialists and doctors, they do have a specialist register. So for example, if you're a surgeon, you're on the surgeon's register. But the problem is when it comes to general practice, which is a huge amount, that is 5 times the hospital admissions people like me see, there is no general practice register like the UK. So in fact, even a 4th or 5th medical student could pose as a doctor and do general practice. So this is not the norm. We need to up our game, and we are asking the College of General Practitioners of Sri Lanka has written to the Ministry of Health and the Medical Council to give us a general practitioners register, so that we could clearly identify who is in private practice and are they suitable to give quality care.
Okay. I remember Dr. Rajitha Senaratne, the former health minister, tried to bring regulation to regulate the prices in hospitals. Any thoughts around that?
Yes, it's 2 different things, price regulation for consumables, I think, is a must, because I do believe that the private hospitals are not exactly being transparent in their consumable billing. When it comes to professional services, Dinesh, as you would agree with me, we could set a reasonably high ceiling, because some skills are extremely specialized, extremely. So I think if you have put in the effort, put in the time to become a specialist in that area, you should be given the liberty to charge a reasonable fee to perform your skills. That is, now nobody talks about, say, for example, Ronaldo being paying 10 or 15 million pounds for a transfer. But when a particular doctor does a surgery, he's sort of accused of fleecing the person. So I don't think that is fair by my profession, because we are skilled workers and we need to be treated as skilled workers. At the same time, we should not fleece the people. We should be reasonable. So setting, I would say, upper limits rather than lower limits is the way forward, and to be across the board. Say you go to any private hospital in Sri Lanka, anywhere, this should be the charge for a particular operation, and we as a profession can help you do that.
Doctor, what is your thoughts about removing the masks or getting rid of the masks?
Yes, Dinesh, I think that's a very pertinent question. Please remember that the COVID pandemic is still going on. The virus is still mutating, and the only weapon we have against it is barrier, because it's transmitted by droplet infection. So the mask is a necessity at the moment. Why we don't, some countries have come out of the mask mandate is because they have achieved enough vaccine coverages. In fact, the third dose vaccine coverages is about 60-70% in those countries. Sri Lanka maybe 30-40%. So once we achieve a reasonable coverage of the third booster dose, then we could think of taking the mask mandate off in public places and in closed environments. Until such time, I think the mask mandate has to be mandated.
Doctor, my last two questions are question number one. How do you compare medical care with countries like India and Singapore and Bangladesh?
Yes, those three countries, MRCGP, still you will be offered the same service in the state. Whereas India and Bangladesh, they do have highly sophisticated private healthcare systems where one has to pay for top care, but they do have public health systems which are not comparable to ours. With regard to Singapore, it is a mixed system where you have insurance plus the state funds you up to a certain degree. So we need to be proud of our state health system, which offers these services free of charge, and we need to protect it and enhance it. But let me take this opportunity to also say that free healthcare system will not be sustainable for the future. We need to think of new financing models so that various taxes, direct, indirect, so that you get the tax, put it into a health fund and get them to pay for the people who can't afford. And I do believe, this is my personal view, that the middle class should be encouraged to go for insurance schemes and offload the state sector and give quality service in the private sector. That's the way forward, Dinesh.
Okay. Doctor, my final question to you is, what is your vision for the health sector?
My vision for the health sector is that where all people are equitably accessed to healthcare, and also the poor are protected, and we need to ensure that the health status is continued. My actual vision for the sector is that we need to become a sector of healthcare, not a sector of disease care. Now the current sector is entirely disease based. We need to concentrate and move away from disease based care to health based care. So that is one way to achieve that, is like you said, through universal health coverage, where it focuses on health, screening and so on, detection, prevention, and not focus on diseases. So in a summary, the vision is for a system of health care rather than a system of disease care.
Thank you, Doctor. It was great talking to you, and all the best in all your endeavors.
Thank you very much, Dinesh. Thank you very much for having me on.